Hi, I'm Donna Clemens, your instructor for contemporary health issues. Today I'm going to lecture over Chapter 2, Promoting and Preserving Your Psychological Health. Your psychological health includes your mental, emotional, social, and spiritual state of being. This chapter is near and dear to my heart because my master's is in counseling, specifically health and wellness counseling, but I'm hoping that I can add some insight to these chapters, just personal experiences that I've had working with clients or in the field of mental health. One of the reasons I put this meme here says time spent with cats is never wasted by Sigmund Freud. Pets are an important part of mental and psychological health. And just for an example of some of the things that we will be talking about during this chapter, studies have shown that pet therapy is an important part of dealing with depression. And anytime you pet your dog or cat, you release hormones physically in the brain, feel-good hormones. And that's why sometimes it can be so soothing to have a pet and to spend time with that pet at the end of the day. So I just thought I would include that in there. That's just one aspect of some of the things that we'll be talking about. But again, remember when we talk about psychological health, there's several aspects of that. And that is how you think, how you feel, how you relate to others, and who you are in your being, in your core, in your spiritual being. Characteristics of psychological health. People that have good characteristics in regards to their health feel good about themselves. They feel comfortable with other people. They know how to control tension and anxiety. They understand what it takes to meet the demands of life, and that's not overwhelming to them. They know how to curb hate and guilt. They maintain a positive outlook. They value diversity, and they appreciate and respect the world around them. Mental health, intellectually speaking, is the successful performance of mental function. Productive activities, fulfilling relationships, the ability to cope with life's challenges. It plays a role in how we think, communicate, express emotions, and feel about ourselves. If you'll take a look at this picture of the brain, you can see all the different intellectual stimulation that's going on there. Emotional health. Emotional health is how we react to life, evaluating our individual emotional responses, the environment that is causing them, and the appropriateness of our actions to those responses and those emotions. If you have a good emotional health, you're able to express your feelings, communicate with others, and show your emotions in appropriate ways. Social health. Interactions with others on an individual and group basis. Your ability to use social resources and support in times of need. The ability to adapt to a variety of social situations. The ability to listen, express yourself, form healthy attachments, and act in socially acceptable and responsible ways. And as you can see there, the meme up there says good social health is being with friends. Spiritual health. The spiritual, personal quest for seeking answers to life's ultimate questions, finding meaning in one's life purpose, seeking a sense of belonging or something greater than the purely physical or personal dimension of existence, the appreciation of strengths and shortcomings, interconnectedness, practice of mindfulness, spirituality as part of a daily life, and living in harmony with our community. Just to camp out here just for a couple seconds, your spiritual health, obviously we are at a Baptist college, university, and so I feel like I can speak openly about spiritual health, and I know there's a lot of different new age ideas and practices going on, and I'm not here to judge anyone that is looking to those types of things for their spiritual health. Just from a personal experience, though, I believe that true spiritual health is found in our Creator. And I obviously believe that God, sovereign God, one and only God, made us. And He made us to include all of these different aspects of health. And that spiritual health and that spiritual component is so important to the overall health of our well-being. And if I had to put one as more important than all of the others, I would have to say it's spiritual health. I think those that are in Christ and believe in the written word of God in the Bible, I believe every answer to all of our questions, whether it's emotionally, physically, spiritually, whatever those questions that we have, can all be answered through God's word. And so looking to a higher power is not enough unless it's God, because He is the ultimate higher power. So I would encourage you, as you look at your overall health, sometimes we tend to camp out on one more than the other. It may be emotional health or it might be physical health. But remember, you can really line up all areas of health by being spiritually healthy and learning from God's word on how to take care of your body physically, and learning from God's word on how to deal with things on an emotional level. I think He is the ultimate source of wisdom, and you will do your life many, many favors, especially be on a good path to a healthy individual if you have this aspect right first spiritually, that you're in a relationship with God, that you love God, you accept His word, you read His word, you believe it's sovereign, you embrace all those biblical principles, is going to keep you healthy and in line, and all those other aspects of health are going to line up and be in balance. So let's talk about some external factors of psychological health. What affects all these areas of health? Well, externally, our family affects those, our community, drugs, neighborhood crime, threats to our safety, injury, school failure, unemployment, financial problems, natural disasters, and positive role models. I'd also have to say negative role models. All of those can be external factors in what affect our psychological health. And let me just give you an example. Again, I like to try to make things personal as often as I can. One of the things that really impacted my health was an injury. I had a back injury about 10 years ago. And I, as most of you know or will start to understand and know about me, is I'm very active physically. I teach a lot of fitness classes, and my passion is health and fitness. And so when I came down with the back injury, I was no longer able to exercise for a while. In fact, after many, many chiropractic visits and other types of probably less invasive procedures, I ended up having to get back surgery. And that was a really hard time for me. It affected every area of my health and well-being. Let's go back to one of our first slides. So remember this first slide that talks about psychological health, mental, emotional, social, and spiritually. That injury affected all 4 areas of this for me. Let's start with, I guess, mentally. Mentally, I wondered if my back would ever be strong enough that I would be able to engage in activities, physical activities, and continue teaching. Mentally, I was on quite a few different painkillers and drugs that really affected the way I was thinking. And sometimes my thinking was a little bit slower or a little bit groggy. And in a lot of ways, it was a mental battle, just trying to stay positive and to realize that this was in God's hands, and continually telling myself that God had a plan for me. And I've always thought that was to be very strong in fitness, and just holding on to those promises through that very bad back injury where I had to actually have some a rod and put in my back, in my lower back. So mentally it affected me. Emotionally, obviously, I was very sad that I was no longer exercising. I was really sad just thinking about the prospects of the future, of not knowing if my back would be stronger, not knowing if I would be able to teach a kickboxing class again, wondering how much limitations I would have. And all those emotions brought me down to a very sad place, and sometimes a depressed place. Socially, I was isolated for a while. I wasn't returning to my classes and had that social network that I once had. It also affected my family. I was on bed rest for several weeks trying to recover from surgery. And so socially it impacted me, and spiritually, obviously, kind of goes hand in hand, and a lot of these will go hand in hand with each other and kind of cross over to all areas, kind of cross over together. But that spiritual aspect of, back to what I was thinking mentally, God does have plans for me, and what am I going to do if I can't exercise the way I could before? And I've used some negative aspects of how it affected my psychological health, but it also affected me positively in the end. And we'll talk about ways of turning those sad psychological battles around so that it does become a positive health aspect for you. But, socially, I remember a lot of people sent me cards during that time, people that I didn't even know very well, or people that I had prayed for in my classes. I have a stack of cards and letters that I kept from people at that time. There wasn't cell phone, believe it or not. It kind of dates me. So I couldn't get texts or anything like that, but I got a lot of cards. And so socially, that really made me a lot stronger, understanding that network of support I had. Spiritually, it did end up making me stronger, because in the end I had to put it in God's hands, and I just realized no matter what, He had a strong plan for my life, and everything was going to be okay. So you can see how all of those aspects affected this external factor of an injury. Let's move on to internal factors. Self-efficacy, and we talked about that in chapter 1. That confidence, more than that confidence, just knowing and believing that you can make a change. Self-esteem, learned helplessness versus learned optimism. Personality, extroversion, agreeableness, openness to. Experience, emotional stability, conscientiousness, resiliency, lifespan, and maturity. All of these things affect our internal health. So we're going to talk a little bit more about our thoughts and what goes on in the mind as we progress. We can learn to be helpless, or we can learn to be optimistic. Again, this goes back to, in biblical terms, something that I'm very passionate about, and I shared with earlier, is I believe that the Word of God has so many scriptures and so much positivity in it that as you read His Word and as you grow in God's Word, you will learn how to apply scriptures to your life, and you will learn how to be optimistic. And again, goes back to that foundation of having a good spiritual health. But all these things are internal factors that affect your psychological health. There's something really popular called psychoneuroimmunology. And psychoneuroimmunology is shown that there is a psychological link between your nerve cells of the brain and the immune system, which is incredible to me. So basically what this is saying is your mental health is affected by your physical health, your emotional health, your spiritual health. All of these are physically affected by the nerve cells in the brain. And I want you to listen to this YouTube video by Dr. Carol. She has written some excellent books about how thinking positive can actually retrain our brains and actually heal physically our brains. I encourage you to YouTube her. She has a lot of videos on YouTube about this. She has also written a book. Highly recommend it, especially if you're in the mental health field or you feel like you are just stuck in some patterns of negativity that you cannot change. She absolutely believes, as a neuroscience, that she has proven that brain cells do regenerate, and they can regenerate in a very positive way. And I'm going to go ahead and play this, let you listen to a little blurb. It doesn't do her justice. Again, I encourage you to go on YouTube and look up more things about her and about her research. It's just absolutely fascinating.
Understand how your brain works, if you can understand how it functions, it makes something that's very very out there, something very tangible. So I teach people about the anatomy of thought, what's actually happening now as you're listening to me, what's going on, how does that thought form in your brain. And then if you think incorrectly, it becomes toxic. So in the second part, I teach people about...
When you say toxic, give us a definition from your perspective of toxic.
Well, toxic is when basically your body functions in an electrical chemical feedback loop. So if you don't think correctly, the way that the nerve cells look like trees, and like you so clearly explained just now, that if it's a good thought, it will be a luscious green tree with lovely green leaves on, but if it's a toxic thought, it's like a weed with thorns on, and it becomes a negative,
like a briar,
exactly like a briar, and it takes up space, and it occupies space, and it grows through the brain, and things like anger and hate and bitterness and rejection and those things, that memory looks different to a good, happy, positive memory in your brain. And when you have those toxic memories actually physically growing, because it's a physical thing that actually happens in your brain, it actually physically grows, it upsets the whole electrical chemical feedback loop in the brain, and then that causes your whole body to, that thought is translated by the middle part of your brain into a physical reaction in your body. So toxic thinking in your brain will actually become a physical reaction in your body. So the way in which you think will affect your intellect, your emotions, and your physical health. And if we can understand that that is a reality, we can also change it, because the scientific research shows us that you can grow your brain at will. So if you've grown a toxic thought, you can actually fix that up, which is amazing, because if you think that if you have an abuse or a rejection or a bitterness or any kind of that becomes a thought that's in your head, because your brain, everything begins and ends in the brain. So if you've got this toxic thought, this toxic emotion in your brain, this actual memory that looks a bit like a tree and it's got all these thorns on, you can actually deal with that. God gives you his incredible ability. Within 4 days you can start changing the way in which your brain functions.
So let's talk about enhancing your psychological health. How do we do this? Well, one of the ways that we talked about this was from Dr. Caroline's perspective. Enhancing your psychological health takes rethinking things and rethinking of how your perspective on things. But here's some other things that would help. Develop your support systems. Complete required tasks. Form realistic expectations. Make time for yourself. Relax and reduce stress. Maintain your physical health. Examine problems and seek help when necessary, and get adequate sleep. All these things can help enhance your health. Now, we can make an exhaustive list of things that, besides what's on here, that can help you with your psychological health. Look over these and think about which ones maybe that you are strong in, maybe some that you're not as strong in. And I'm hoping throughout the weeks in this course that I can help you develop your psychological health and help enhance it. For example, one of the things that we'll do is we'll do some stress reduction and relaxation techniques. And you'll learn about some of those and you'll practice some of those, and some you may not be used to doing. And so within that assignment, hopefully you'll find some ways that you can make time for yourself to help you relax, because that's really important, especially in today's hurried society. Developing support systems is so important, and getting rid of toxic relationship is equally important. I know that there have been a couple different times in my life that I have reassessed the friendships that I have made, and decided on some occasion that I didn't want to be friends with certain people because they weren't supportive and they were bringing me down and causing negativity. And so sometimes it's simple as just reevaluating who you hang out with and forming new support systems. One of the greatest support systems I've ever had is within the church. And again, here's my my spiritual, psychological aspect of health coming out again. I am a preacher's daughter, let me remind you of that. So I will probably be a little bit heavier on the spiritual side going through this course, but the support systems that I've had in church have been phenomenal. And finding a group of people that have similar beliefs and can pray for you and encourage you with God's word has been extremely valuable in my life. So anyway, if you want to take a look at those, maybe even getting more sleep. And we'll look at these more in depth as we move throughout this course. But it's worth noting that these are some excellent ways to enhance your psychological health. Okay, let's look at the definition of mental illness. A mental illness are disorders that disrupt thinking, feeling, moods, and behaviors. It causes varying degrees of impaired function of one's activities of daily living. There's a specific criteria for mental illness. The DSM-V is the most current criteria, and I have listed a link to that that talks about the DSM-V. And as a mental health professional, I am required to diagnose a mental illness and apply these numbers and these codes according to what I have found when I've sat with a client and gone through their mental health. So the definitions in that manual and are a little bit exhaustive, and they will tell you exactly, not exactly sometimes, but more specifically what type of disorder you have according to your symptoms. But going back to this mental illness, disorders that disrupt thinking and feeling, moods, and behaviors. All of us struggle from time to time mentally, and all of us will go through times of depression. And just because you go through, which is also can be diagnosed as a mental illness. Just because you're depressed does not mean you have a mental illness. Just because you're OCD about having to leave all the lights on in the house when you leave. You can't leave it all. Doesn't mean that you have, you know, an OCD mental illness. Just because you have some symptoms of mental illness does not make you mentally ill. It's when these disorders disrupt your everyday lifestyle. They start getting in the way of a normal lifestyle, a normal thinking and behavior pattern. When you start to do things outside the norm and outside of balance and not balanced and to the extremes, and they affect your work and your job and your friendships and your relationships, that's when they start to we start looking at them from a mental order. They become a mental illness at some point. Now, I want to give you my opinion as a mental health professional. I do not like for someone to say, I am this mental illness. I am schizophrenic. I am depressed. I am borderline personality disorder. I am a manic depressive. I don't like people to say I am this. I don't feel like, and this is my opinion, and there's a lot of varying opinion in the field, but I do feel like, and I have seen God completely restore and completely heal people of mental illnesses. And once you have a mental illness, it does not mean you will always have a mental illness. I do not believe that philosophy. There are philosophies out there that say that. I do not believe that. I absolutely believe 100% that people suffer from mental illnesses. Absolutely 100%. That you may have a mental illness at certain times in your life, but please, please, please do not let that mental illness define you and make you something that you're not. Realize it is something through therapy and counseling and drugs and hospitals and all kinds of holistic mediums that you can use to overcome your mental illness or to help you through that mental illness. And you may struggle with that mental illness for a very, very long time until you get the right type of help and until you find that those few things are going to help you through it. But don't let that mental illness define you. That's the biggest thing I want you to understand about mental illness, is that yes, you can suffer from one, and yes, you can have those symptoms, but you also can be completely and 100% restored and healed from mental illnesses as well. So here's some disorders that we need to talk about, some mental disorders. There's anxiety disorders, generalized anxiety disorder, otherwise known as GAD. There are phobias. There's panic disorders. There's OCD, obsessive compulsive disorders. And there's post-traumatic stress disorders. And those are all categorized under anxiety disorders. Post-traumatic stress syndrome has gotten a lot of attention, especially when men and women have come back from the military, or they've been in different types of wars. We hear that quite a bit, them diagnosed with post-traumatic stress syndrome. Policemen, especially nowadays, with all of the trauma and the violence that they have to deal with, often struggle from that disorder. We categorize that in the mental health field as an anxiety disorder. There are also personality disorders. One of those is schizophrenia. And any of these disorders, you can find out on YouTube or look up online. And schizophrenia is a very sad disorder. I worked with quite a few mental health patients that had schizophrenia. It's a very, very real disorder to them. A lot of times they're paranoid and they feel like people are stalking them and talking to them through billboards or newspapers, or giving them silent messages of doom and gloom. And some of the stories, could be quite comical, but realizing that that these people that suffer from disorders, it is a real thing that they are feeling, and it's not to be discredited or made fun of in any way. I remember one particular patient who most of the time, schizophrenics are confined to their house. They don't want to leave because they're very paranoid, and they're very scared of people being after them and chasing them and that type of thing. So for them to get out of their house is a huge feat. And I remember one particular patient was so excited that her husband was going to take her shopping, and through this shopping event, she ended up hiding in the middle of the clothes racks. For a lot of the shopping trips, she was, just convinced that people were watching her, and that in one of the coupons her name was written in there, and they were out to get her. And again, they can sound kind of comical from the outside looking in, but it's a very, very sad disorder, when you realize that mentally speaking, these people really believe that people are out to get them and hurt them. So that's one of the personality disorders. It just affects your personality and who you are. And then there's mood disorders, and I think the mood disorders seem to be a little bit more common, especially in today's age. There's almost everybody I know have experienced a mood disorder, whether it's major depression, a seasonal affective disorder is huge, bipolar. Postpartum has gotten a lot of attention in the last several years, and actually I suffered from postpartum depression, and I had 3 children, and the first 2 were little boys, and was excited to have them, and the third child I found out was a girl, and obviously was over the moon that I was going to have a girl. Bought every hair bow that you could. I think she had 125 hair bows by the time she was born. I know that sounds crazy. I'm just letting you know, again, personally, from a personal perspective, how postpartum affected me, that I was just so excited to have this little girl and finally be able to do all the girly things. And after she was born, I went into this depression, and I wasn't excited at all. And I cried a lot, and couldn't understand how I could be so excited waiting for this little girl to come and buying all these really fun, frilly things, and all the way up until her birth. And then after her birth, I was just overwhelmed and sad and wasn't excited, and just realizing through that, with my OB-GYN's help, that I was suffering from postpartum depression, and was able to to do some things to help overcome that depression. And after about, I think I suffered probably for about 6 to 8 weeks. And after that, after I was able to get therapy, and I didn't have to get drugs at that time. I was able to take some holistic things that helped me with my depression at that time, which anytime, again, on a side note from a mental health professional, anytime I can get a client to comply with taking something natural or holistic first, I will always try that route. I am not opposed to drugs and medications, medical in the MDs prescribed. As a counselor, I can't prescribe meds. I can prescribe holistic medications, but I cannot prescribe a lot of the medications that MDs or psychiatrists will use to treat these disorders, and I will have to refer them out to a psychiatrist. I do believe God has made everything in nature that can help us with getting our chemistry right in the brain. And so I will try natural routes very often with my clients to help them overcome a lot of these disorders. Again, not opposed to using drugs, but I use that as a last resort. And so anyway, that was just a side note. But again, you can see kind of some categories of disorders here. Let's talk about anxiety disorders. It's the #1 mental health problem in the United States. It consummates worriers who develop a debilitating level of anxiety. They can come in the form of panic disorders like panic attacks, and these are acute anxiety reactions that brings on an intense physical reaction. You can read a little bit more about panic attacks in your book, but a lot of times the heart rate will increase. The person having a panic attack will feel like they can't breathe, or maybe that they're choking, they're not getting enough air. If you've ever had a panic attack, it is an absolutely horrible feeling. And a lot of times people think they're even having heart attacks. It can be that uncomfortable. And so that's one way that people react to anxiety is through panic disorders. And if you start to have quite a few panic disorders, you definitely need to see a counselor and try to get help in overcoming those, because those can be debilitating. Just the thought of having a panic disorder can actually bring on a panic disorder, believe it or not. So that's just definitely something that you need to get help with, or someone who has a panic disorder needs to seek therapy. There's obsessive compulsive disorders, compelled to perform rituals over and over again. And again, all of us probably have a little OCD somewhere in us, but when that becomes, again, abnormal and out of the norm and starts to affect our everyday life, then it becomes an OCD. And the phobic disorders, the social phobias, persistent fear and avoidance of social situations. And one of those that we just talked about would be like schizophrenic, or there are people also that are afraid even to leave, maybe afraid to leave their house, afraid of germs. There's a lot of phobic disorders. Probably anything and everything you can think of is listed in that diagnostic book that we talked about. Fear of spiders, and that's kind of a common one. But there's fears of just about everything you can think of can become a disorder and a phobia. We talked a little bit about depression a couple slides ago, but I think this meme up at the top describes it very well. "What is depression like?" he whispered. "It's like drowning, except you can see everyone around you breathing." And any of you that has experienced depression will understand what that meme is saying. And it's a very, very bad, horrible place to be at. And a lot of times, again, depression for a short time is normal. God built, I believe, built emotions into us, and we're wired, and sometimes depression is a way of coping with things. And if you're never depressed and you're never down, something's probably equally wrong. I mean, there are things in this life are sad, and loss of loved ones, when somebody's chronically ill, just all the violence going on can be depressing and can leave us in a depressing state. But when that depression becomes long-term and becomes something that you simply just can't get over through, in a normal, reasonable amount of time, then it can become a disorder. And it can be external or internal triggers. But the characteristics of depression, and again, for short time, these are all normal, but for a long period of time, probably the feelings of sadness and hopelessness for an extended period of time, loss of pleasure in doing usual activities, poor appetite and weight loss, insomnia or disturbed sleep, restlessness or fatigue, thoughts of worthlessness and guilt, trouble concentrating or making decisions, and thoughts of death or suicide. Again, we talked about it becoming a disorder after a certain length of time. If you experience at least 5 of these symptoms most of the day, nearly every day, for at least 2 weeks or more, then it could be a disorder. So it's just something to think about, to kind of gauge yourself. Is this becoming a mental illness, my depression? So it's interesting to note the differences between men and women when it comes to depression. Women are almost 2 more times likely, or 2 times as likely, to experience depression. Their coping strategy is to focus on the problem. Hormonal changes, menstruation, pregnancy, postpartum, menopause can all affect the woman's hormones, which can then cause depression. And women usually have more difficulty obtaining restorative sleep. When it comes to men and depression, they're less diagnosed, and I don't know if that's because men are less likely to seek help. There's a lot of theories out there. It could be a societal. We talked about how external factors can affect our psychological state. A lot of times there's that mentality that men are stronger, men are tough, and sometimes that definitely affects the diagnosis of depression for men. But their coping strategy is distraction, not really getting to the root of the problem, which isn't always a good thing. Women tend to focus on the problem, and sometimes that's good because it helps us get to the root of the problem. Being distracted is not always a good thing, but often men mask their depression by alcohol or drug abuse or working excessively long hours. And men tend to be irritable, angry, and discouraged. So if you've noticed any of these symptoms in those males or females in your life, you may want to think about encouraging them to get help, and kind of realizing these are 2 different ways that men and women handle depression. And just understanding that helps us be able to help our loved ones. If you've noticed that the man in your life has become more irritable and angry lately and seems very discouraged, you might want to, find out if possibly he is depressed and encourage him to get some help. Schizophrenia, we talked about this already, is characterized by those delusions, hallucinations, paranoia, disorganized speech, and sometimes catatonic behavior, which is not speaking at all. So again, I already talked about this. It's important to note that it does only affect about 1% of the United States population. So, to have this is extremely rare. Often we find schizophrenia in late teens to early 20s is usually when they're diagnosed. Most of this 1% is diagnosed, or usually the onset of schizophrenia happens. Actually, you can see the chart. Let me double click on here a little bit. And you can see the ages of the men and women right there between 15 and 25. They've also done studies of the brain. You can see a normal brain versus a schizophrenia brain, and different parts of those are lit up differently. Again, this just goes to show that there are physical things that take place in the brain when you have a mental disorder. And back in the day, people would just say, pull yourselves up by the bootstraps, get over it, there's no such thing. But it's nice to have all the modern technology to let people know it's not just all in your head, so to speak, mentally, that there actually, it is in your head, and there are physical reasons and chemistry and things that happen that can cause these mental disorders. We're going to shift our gears towards suicide here, because suicide can happen as a result of mental disorders. mental disorders don't necessarily cause suicide, although the symptoms of the mental disorder can cause one to want to commit suicide. I did an internship with on a suicide hotline where I was actually certified to help talk people down when they're trying to commit suicide, or trying to help a client understand why he's having those, or she is having those type of thoughts. And it was a huge wake-up call for me. And I do want to spend a little bit of time going over this. The warning signs of somebody wanting to commit suicide, there's direct or indirect statements made, usually, like, you know what, life isn't worth living anymore, and those type of things. And sometimes we say those in jest, as we're just, oh, this has been a horrible day, I just wish I would die. Well, we've all said those things carelessly before, but if you start hearing that, maybe on a regular basis, or you hear that, and somebody doesn't seem like they're kidding, those are some things you kind of want to take note of. An increasing social withdrawal or isolation, irritability, tiredness, indecisiveness, apathy. So if somebody that all of a sudden just doesn't care about anything anymore, maybe they were passionate about music, and you would talk to them a lot, and they would be sharing about music or going to a concert or excited about buying an album or downloading something, from iTunes. And all of a sudden, they just don't care about that anymore. They're not passionate about that. They're not passionate about anything. They just don't care. They're apathetic. That might be a sign that somebody is starting to go down this path of wanting to commit suicide. They might withdraw and not spend very much time with their friends anymore, want to stay in their rooms all the time. They isolate themselves. The sudden, inexplicable lightening of mood or giving away of possessions. There's two different things there. Short-tempered, or all of a sudden euphoric. I mean, either one of those can be just an extreme change in somebody's normal mood. Can be somebody who's thinking about suicide, or perhaps they decide they want to give all their possessions away. Yeah, I don't need this anymore. I'm going to give my dog away. Can somebody take care of my dog? And you just start noticing, they're starting to sell things or giving away things in preparation of committing suicide. Their marked change in appearance. Now, this can go either way. We would like to think a lot of times appearance can be they let themselves go. They don't care anymore. Somebody who once really cared about fixing their hair and dressing nicely, and all of a sudden they don't care about their appearance. Or it can go the other way. All of a sudden they're dressing up and they're putting makeup on, and they've changed. You used to not care, and all of a sudden you notice that they're really putting a lot of time and effort into their appearance. It can go either way. A change in behavior, just any type of behavior, or a change in personality. One of the things that really hit home to me when we were watching suicidal videos and different advice and tips from policemen, when they dealt with people either getting ready to commit suicide or had committed suicide, one of the instances that sticks out in my mind is a young man in his late teens, was suffering from depression, and everybody was trying to get him help, and he had been to doctors, he had been in and out of a mental institution, and just lots of different things to help him, and they just could not pull him out of this depression and this bad mood. And then all of a sudden, 1 week, he just changed. He was in a good mood, and he was happy, and he was just telling everybody how much he loved them, and being real positive. And he changed the way he looked. He was dressing up. He went out and bought a couple new outfits, and he planned a party. He had a big party. He felt so much better that he wanted to have a party. And so he got his friends together and asked them to come over for this big party, and everybody was just commenting about how, wow, this is crazy. This guy is totally turned his life around, and look at how positive he is now and how happy, and we're even having a party. And it was a week later and he committed suicide. And so hindsight, looking back at that, was that change in personality, that change in behavior, that marked change in appearance, that sudden mood shift. Sometimes those are all warning signs as well. Anything to the extreme is obviously, there is a sense of relief once somebody decides to commit suicide. Somebody just doesn't wake up and say, I want to commit suicide. It's a very thought out process. A lot of people think it's very spontaneous and that people just decide, okay, I'm going to put a gun to my head. But a lot of times that's not the case. And somebody who's really going to commit suicide, they have put a lot of time and thought into this plan and what they're going to do. And so those changes in their behavior and personality can be a sign that they're finally relieved that they have decided to commit suicide. They're going to be relieved of all their pain, and so there's this euphoria and this party-like spirit. Not in everybody, but in some people. So that's just something to think about. Your high risk factors is somebody who may be considering suicide. Is it recent loss or an inability to let go of grief? A suicide by family members or friends? Readily available means of committing suicide? Like if you've got a lot of guns in the house, history of substance abuse or eating disorders, or a history of serious medical problems. So all those will put people in a high-risk category. The one thing that I do want to talk to you about in terms of suicide, and something that I want you to remember, is don't be afraid to ask somebody point blank. Just ask them, are you thinking about suicide? You would be surprised at how many people that have tried to commit suicide and not been successful. They'll go back and be interviewed, and one of the things you hear them say over and over is, nobody asked me. If somebody would have just asked me, I probably would have said yes, and I probably could have gotten some outside help. But a lot of times this is such a serious taboo that we don't want to talk about, that we'll avoid the subject and we won't even ask somebody. So it's really important that you ask. If you think somebody's going to commit suicide, just come out and ask. One of the biggest things I learned in suicide prevention when I got certified in this was to make sure you ask the right questions. And one of those questions is, are you thinking about suicide? One of the biggest favors you can do for somebody who may be going down this path is to point blank ask them that question. And that opens up dialogue. And if they hesitate, wow, then you know that they have been. And you can open that dialogue and you can help them get help or whatever you need to do. But there are there's a lot more tips that I could share with you. If you ever want to get certified, actually anybody can get certified in suicide prevention. And I encourage you to look up on YouTube or look up on the internet and find those sites that will help you recognize and identify people that are trying to commit suicide. Obviously, if any of those people that you ask have a plan, a PLAN, they already have a plan. They know how they're going to commit suicide and they know when. So they've got the pills, they've got the rope, they've got the gun. Those are all huge, serious, urgent red flags, and you must get them help. And there are a lot of 800 numbers on the internet that you can call immediately, 24/7 access to people that will help you with those people that have suicide, or actually those suicide victims can call those numbers. One of the things I did with all three of my teenagers, and when I learned this, is I gave them the 1-800 number to suicide prevention, and it had a staff of counselors, and almost every city has one. It had a list of counselors that would help them anytime that I said, anytime you feel like you're heading down this road, please call this number. So it's just a good thing to have on hand, and it's a good thing to give other people. So I encourage you to look in your area and find those numbers and put it in your phone and share it with your friends and your family. It can be literally save them. from going down this dark path and committing suicide. I also want to say one more thing, because again, this was one of the things that I specialized in. It is very, very important. If you see number 2, high risk factor, suicide by family member or friend actually puts you at greater risk for suicide. It is so important that you get counseling if you have a friend or a family member, somebody that you were close to, committed suicide. You need help and you need counseling and you need a support group. Do not try to go through that alone. You are at a high risk of committing suicide yourself. And I know people think, oh, I would never do that. But you don't know until you're in that situation. So if you have had a family, friend, and anyone close to you commit suicide, please seek help and please seek a support group. Go get counseling and reduce your risk of actually going down that path as well. Again, here's some other things about seeking help. Never be afraid to ask for help yourself. Get a checkup. Evaluate your psychiatric history. You can get a mental status exam. These are some health professionals that can help: a psychiatrist, a psychologist, a psychiatric social worker, a counselor, a psychoanalyst, and a licensed marriage and family counselor are all health professionals that you can go to. Sometimes even a pastor can help as well, depending on his background. And just because he's a pastor is not going to make him automatically a good counselor. But there are a lot of pastors out there that are good counselors. So that would be another one I would add here. But make sure you seek help. Here is some other things about getting help. Therapy, different types of therapy that can help is psychodynamic therapy, interpersonal therapy, cognitive behavioral therapy. Those are all 3 treatments when you suffer from a mental disorder. The psychodynamic therapy primarily focuses on the unconscious content of a client's psyche in an effort to alleviate psychic tension. So it's very similar to psychoanalysis, and that's one way that we deal with mental illness as health professionals. And then we have interpersonal therapy, and it is a brief attached focus psychotherapy that centers on resolving interpersonal problems and symptomatic recovery. And then there's cognitive behavior therapy, and that's the one I like to camp out at quite often. It is also a short-term, goal-oriented psychotherapy treatment that takes on a hands-on, practical approach to problem solving. The goal is to change your patterns of thinking or behavior that are behind people's difficulties. And so by changing that, they change the way they feel. And then lastly, you have your drug treatments, which are, again, we talked about, are prescribed by doctors. They can be very effective alone or in combination with cognitive therapies, which I always recommend. If you're going to start taking some type of drug treating and mental illness, I think you should try to combine therapy with that and counseling. And then unfortunately, there's a lot of side effects with a lot of the medications that are negative: dry mouth, headaches, weight gain, sexual dysfunction. I mean, there's a list that goes on and on and on. And that is why, again, when I talked about holistic modalities, and there are a lot of other things that we can try before we move to the drugs. The drugs not only cause a lot of side effects, a lot of times with a mental illness, your body adapts to the medications over time. And then you have to switch medicines, and a lot of times the dosages have to be regulated and re-regulated. A lot of times they have to increase in order to continue to get the same effect, because our brains adapt to the medicine. So there's just a lot of issues that happen with the drugs. Yes, they can be wonderful, and they can definitely help and help somebody overcome these disorders. but there's also a lot of negative things that come with the use of the drugs too. So that is chapter 2 on psychological health. I hope that you can see the importance of your psychological health and how many things can affect your health. Hopefully you'll learn some things from this chapter that you can move forward and be encouraged that you can have a very healthy way of thinking, feeling, relating, and being.